Hello, good afternoon everyone. It's a popular demand that we talk about the danger signs in childhood illnesses because parents, caretakers at home want to know that when is it that we have to bring the children to the emergency unit when there's something abnormal about the child. So today we are going to concentrate on looking into the danger signs that we have to bring the children without any doubt immediately to emergency. Okay, so we're going to begin with some very simple outline because we're going to talk about the few very important illnesses, especially severe infections, the most common thing that cause high fever, and then parents may wonder whether it's warranted immediate attention. Then of course metabolic diseases, I'm going to talk more about it in a while. Inflammation, tumors, that means cancers, and accidents, which is very common especially at the ages between 1 year to 5 years. And parents always wonder, when is it that head injury may actually cause child to have bleeding in the head, or whether this burn is severe enough that we need attention by the emergency unit immediately. So we're going to start with infection, especially brain infection in children, because brain, as you know, is the main organ in the body, and brain infection, if it's not treated early, it can cause disability to the child in terms of hearing, eyesight, learning, and the consequences is actually for life. And of course, pneumonia, lung infection, is also an important aspect where the child may lack of oxygen and need oxygen support immediately. Heart infection, intestinal or gut infection are also a very common condition. Of course, things that can bone infection, blood infection are very common in children because they are having lower immunity than adults. And the next common condition that children will have is metabolic condition, where children may have due to certain condition, for example, excessive vomiting, where their sugar is low, their salt is deranged, or sometimes they have children type of diabetes, where the acid in the body is so high that they get fast breathing, and it could be very dangerous, and we need to save the children as soon as possible. And then the next one is inflammation. What is actually inflammation? It's basically radang, and it could be because our own antibody fight our own body. For example, in brain condition where it's called ADEM or ANAC condition, where there's antibody attacking our brain cells. Sometimes it also attack our cells of the eyes, nerve, where it's called optic neuritis. And a condition called Kawasaki is when the inflammation happens in the heart, and it could be causing heart attack in children in future as well. The accidents is actually can be involving injury, for example, car accidents. It can be because of electrocution, where they simply touch the power points of the switches. It can be because of burns when they pull down hot objects from the tables. It can be because of chemical exposure, where they touch acids or things that are abnormal, and commonly falls, where they can get broken arms and even broken skull bone or even bleeding in the head. So injury is something preventable but very, very difficult to treat sometimes if it's severe. So if you follow the WHO World Health Organization, there are 4 criteria where we can look for the danger signs of children. This is very easy to remember and is used widely in many countries. The first one is baby cannot drink. If a baby cannot drink, that means the baby is going to get dry. There are many conditions that can cause it. For example, severe infection, brain injury, throat infection that is very severe, and of course inflammation, for example the brain inflammation. These are all causing cannot drink. Vomiting and diarrhea, which is excessive, happens very easily in children who have very low water content initially. When they have vomiting and diarrhea continuously, they actually get dehydration, and it can be life-threatening. Then if the child is less responsive, for example drowsy and sleepy the whole day, or acting abnormally, for example crying the whole day non-stop, or having high-pitched cry or continuous cry for more than 1 hour, could be an abnormal behavior signifying brain infection or sometimes severe abdominal pain caused by intestinal obstruction. Of course, if it's a brain injury or a brain infection, inflammation, it can be presented by fits which is something that we need to treat as soon as possible because it's also life-threatening. So from these 4, okay, we can actually expand it a bit more to go to 6, if you can remember the basic 4. The other 2 aspects are the color, okay, and also the breathing. These are very important aspects where you can look into a child for life-threatening signs when they cannot talk. So we have to look for them for the danger signs. Okay, I'm going to show you here. Color, if the child appears pale, it could be because not enough blood, not enough oxygen, or poor circulation. How do we check a circulation for the baby? Is when we press on the finger and then we release it. If the finger becomes red quickly, that means the blood circulation is good. But if we press 1, 2, 3, it takes more than 2 seconds to become red again, that means the circulation is poor, that is dangerous. If a baby is crying and the lips looks blue, it could be lack of oxygen as well. If the eyes are yellow, it could be a liver condition, for example, liver infection that can cause the changes in color. Of course, we are most worried if it's a bad infection causing this kind of bleeding under the skin. It's due to a severe brain infection caused by a bacteria called meningococcus. Okay, I'm going to show you some of the pictures of feeding and also breathing difficulty here.
First aid for a seizure.
Oh, Harry, you're just having one of your seizures. Don't worry. Mummy's here.
Protect them from injury.
Don't worry.
Do not restrain them.
Be all right. Just listen to my voice, Harry. Just going to check your breathing. All right. I'm just going to roll you over, Harry. Okay.
When the seizure is over, help them to rest on their side with their head tilted back.
There we go. Okay. That's it.
Remember, make them safe and prevent injury.
Okay, so now you can see how a fitting child is look like, and then there's a short clip that how we can manage the baby when the child is fitting at home. Of course, you need to bring the child to the hospital as soon as possible. We're going to continue with the second video which shows breathing difficulties. Okay, after seeing the 2 videos, we're going to give you a bit more revision of what are the danger signs in more detail. So the first one, the danger signs that we want to really look into, if it's a child appearing abnormal. So of course, if the child is appearing drowsy, sleepy, tired, and then refusing to drink, it's definitely something abnormal. And if the child is looking at you but not focusing, so it could be a sign that the child is having disturbances in his consciousness. If a child appears floppy, that means no energy, weak. It could be a sign that there's an inflammation or infection in the brain. Of course, if the child is crying non-stop, crying high-pitched, crying abnormally, so it could be disturbances in the brain. And when the condition is very severe, they can get into the fitting, like what I've shown you in the video just now. This is a general sign. If you look into more detail, then we can look into the temperature. If a child has very high temperature, more than 38.5 continuously, so it could be signifying infection that could range from anything from brain, lungs, urinary tract, kidneys, liver, lungs, so any part of the body. If the child has rashes that we have explained earlier on, from being very white to very blue, very yellow, or even very red rashes on the body. then definitely are concerned that if the baby is not getting oxygen, then they have this condition where there's fast breathing or even stop breathing. When the child breathes too hard and the muscles are tired, they can actually go to apnea, which is stop breathing. Abnormal sound, when the baby is breathing, it has this grunting sound, or wheezing sound, those are signifying that the airway of the baby is tight and oxygen can be restricted to the lungs. Of course, if the baby is having retraction that we showed in the video earlier on, and you can see here that when the baby breathes, the pulling in of the muscles are so bad that the shape of the chest is changed. So we have talked about the general condition, the temperature, the color, the breathing. Next, we look at the things that the baby is vomiting. If the baby is vomiting more than half the fits or the past 3 fits, that's definitely more than what the baby is able to tolerate, unlike adults. If the baby is having difficulty, tiredness to drink, or having less urine output, that shows baby is really dry, and water content is so important for a baby. If the vomitus is greenish like this, that means that most probably there's something blocking the part of the intestine. And if it's blocking part of the intestine, the greenish bowel may signify an urgent surgery for a baby where intestine is twisted. Of course, if there's a blood in the motion, it could be because of severe infection in the intestine. And when baby is crying continuously, complaining of severe tummy pain, it could be something like appendix or something like twisted intestine as well. So if you look at the area of the tummy, so a different part of the tummy has different meaning when there's a severe pain. For example, if it's early appendix, so it will be pain in the middle, then it will be moved on to the right lower corner. If it's a kidney infection, there will be pain at the back and also at the sides. If it's a liver infection or there's infection in the gallbladder, it will be the right upper zone. If it's an infection at the left lower zone, it could be because of severe constipation or infection at the large intestine. So when we examine the child and when we touch the babies or the children's tummy and it becomes tense and hard, it could be something that we really need emergency attention by the surgeon as well. Okay, so now we move on to 3 scenarios that we're going to demonstrate to you on how to manage emergency cases at home.
Doctor, baby stop breathing.
Oh no!
I'm gonna go call for help.
After call for help, immediately we need to check for the breathing of the baby. Look at the movement of the baby and then look at the chest, whether there's any movement. If there's none, we open up the airway, make sure the neck is straight, and then check whether there's anything blocking the mouth. So we will look at baby's breathing. If there's no breathing, immediately we're going to give rescue breath. It consists of 2 breaths and 30 compression. Hold the neck properly, put the mouth around the nose and the mouth. Then we look at the chest rise during the breathing rescue breath of 2 times, followed by immediately chest compression. The area for chest compression is from the lower rib, we point up to the sternal area. Use 2 or 3 fingers and press hard until the chest is 1/3 compressed. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 until 30. Then put the mouth around the nose and the mouth again for the baby and blow, looking at the chest compression. 2 breaths again, followed by 30 compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Doctor, oxygen supply is here.
Okay, when there's oxygen in between the chest compression, we can supply the oxygen if it's available, but the rescue breath should not be stopped. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we opt for 120 breaths per minute. Fortunately for this baby, after 3 rounds of 2 rescue breaths, alternate with 30 chest compression, the breathing movement has come back to normal. The color has changed from pale to pink. Baby is immediately sent to the emergency unit for further treatment. Okay, we're going to move on to the second scenario where a baby that presents with fits how are you going to do if it's at home, and then what is the emergency steps that we need to take.
Doctor, baby is fitting.
Oh, okay, let's clear off the things from baby. Make sure there's no injury. Yeah, so we're going to check the breathing. Okay, the breathing is still not good. Look at the time for baby. How long the baby is fitting already?
Baby already fitted for 3 minutes.
Okay, so we must make sure that baby is not choked by the own saliva. We put baby to the side. We're going to take medicine to stop baby's fitting now. This is rectal diazepam. Okay, we're going to put in for baby to stop the fitting. Okay, so baby is still fitting. Okay, we're going to make sure that baby is not choking, and then we're going to make sure the airway is okay. We don't push hard on baby because we can cause injury by restraining baby. Make sure baby is not having anything around that can cause injury. Okay, if the fitting is still not stopped, then we are going to go for CPR. Baby has stopped fitting, luckily. We need to bring to emergency unit, especially if this is the first seizure of a baby. If the fitting is more than 5 minutes and baby doesn't appear to wake up from the fits in between, if there's a history of brain injury or there's a history of fall that could signify brain bleeding, we had to make sure that the baby does not have a life-threatening condition. If baby had already fitting history, but there's a changes in the style of the fitting, it could be something else that's happening. If baby has been vomiting and diarrhea, it could be salts imbalance that cause baby to be fitting, and this has to be treated immediately as well. Yeah, so fitting is something that really need to do an emergency treatment as soon as possible. The third and final scenario that we're going to demonstrate to you is choking. It happens easily at the age where the child is starting to learn to feed, but it can go anytime up to the age of even 3 years, 4 years when they take something that is hard and small, for example peanuts, even sometimes battery, coins. So we're going to look at this scenario now.
Doctor, baby swallowed a fishbowl and now baby stopped breathing.
You can go and get for help, please. Okay, so most importantly, we look at the breathing of the baby. If baby is not breathing, we're going to have emergency treatment for choking. So first of all, we open up the airway and see whether we can sweep off anything that is remaining of the mouth. Then we're going to turn baby upside down, hold it with one hand with the support of the whole arm, and let the legs go across the arm. Then we're going to do a effective thrust, 5 thrusts like this, and turn around. If baby is still not breathing, we're going to start with the CPR. 1, 2, 3, 4, 5. Repeat the thrusting again 5 times, and it can be repeated until baby is well. 1, 2, 3, 4, 5. Again. Alright, baby has started breathing and the thing has been vomited out, so we can stop the emergency treatment now. Check again the airway. Make sure baby is having a smooth airway, the natural breathing, and if this is the condition, then we do not have to go on for CPR. If let's say after few cycles and baby is not breathing and turning white or blue, we have to go for a CPR. Blow 2 times, hold the head right with the good airway. 2 times, and chest compression 1, 2, 3, 4, 5, 6, 7, 8. If baby is too heavy, we have to sit down and put baby on the our thigh to make sure that baby is safe. Hold baby carefully around the neck or the chin or the shoulder to make sure baby doesn't slip down, and do a hard thrust to hopefully dislodge the foreign body. 1, 2, 3, 4, 5. Then repeat with the chest compression 1, 2, 3, 4, 5. This cycle have to be repeated 1, 2, 3, 4, 5. But if baby looks blue or white, we have to give rescue breath for baby. Open the airway, look at the breathing. 1, 2, 3, 4, 5. Then if we need, we can dislodge baby again. Okay, repeat until baby has vomited out the object or when the help has arrived for definite treatment for baby. This is the way that we have to administer for choking baby. this is actually a very dangerous condition because it's blocking the airway from oxygen, and if the lack of oxygen can actually cause brain damage if it's more than 4 to 5 minutes. Emergency treatment of children is so important because if we know how to do it at home, the basic steps, we can give the split seconds of safety to the children with the adequate knowledge, and also when to bring baby to the emergency unit as soon as possible to avoid devastating condition to continue. If you have any queries, we welcome you for your questions and also comments. You can also email me at my email address as seen here. Thank you very much for your attention, and we hope all our children stay safe and healthy, especially during this COVID condition. Thank you very much.